Hi, my name is Megan Deister. I am an occupational therapy student at King Medical Center, and today I'm going to be presenting to you on some fine motor challenges. So what are fine motor skills? It's the coordination of small muscles of the hand, the finger, and the wrist. You use fine motor skills for feeding, dressing, cooking, cleaning, and many more daily tasks, and even writing. So any kind of difficulty with these fine motor skills could lead to frustration completing those tasks successfully throughout your day. So the relationship of fine motor skills to different types of dementia, it definitely varies by the types. So someone with Alzheimer's disease may have more difficulty with fine motor skills in the middle to late stages, whereas someone with Lewy body dementia may have difficulty in the earlier stage due to tremors. And then other types, such as FTD and progressive supranuclear palsy, these may be more apparent because they primarily affect movement. And then vascular dementia, it is dependent on areas of the brain that are affected and if fine motor skills are affected earlier on or later on in the disease progression. So some difficulties that a person with fine motor skills may encounter include grasping items, fastening buttons and zippers on pants or shirts, tying your shoes, putting on a belt, and then putting clothes on a hanger and putting them away. So next, I'm going to talk about adaptive equipment that you can do to help your loved one be more independent. And it's important to note that, these different pieces of equipment might work for just a window of time, but the importance is maintaining their dignity and helping them be as independent as possible. Some of these things you might have to help them start, and you might be showing them each day how to use them. However, it's about helping them maintain their dignity and participating in their daily routines as much as possible. So the first one I'd like to talk about is a button hook, which is shown here on the top left. So as you can see, it has a larger handle, so it's a little easier to grip. And that left side of it hooks around the button, and you're able to push that smaller end through the hole in order to button the shirt. And then a zipper pull. These might need to be put on by the caregiver. However, it's easier for them to maybe loop a finger through that opening to pull up and zip a jacket or unzip a jacket. And again, they might need some help starting the zipper part, but it's easier for them to zip their jacket up and down. There's many different types of zipper pulls, and they come in many different colors and materials as well. So the next one I'd like to talk about is here on the left, the reacher or the grabber device. This is good for maybe picking pants up off the floor if you're sitting at the edge of the bed and your loved one isn't able to bend down all the way to pull their pants up. This is a good way for them to grab it and bring it up to a point where they can reach it safely. It could also be used for taking your socks off by putting that right side where you grab the items, putting one of those down into the sock to pull the sock off. And it could also be helpful for getting things higher up off a shelf or something. If they have a piece of clothing that's maybe hanging higher up that they'd like, it might be easier for them to grab something like a hanger or part of the hanger to take it off of a shelf. And here on the right is a shoehorn. And so as you can see, the shoehorn's inserted in the back part by the heel. So the purpose of this is to keep that back part of the shoe open, so the heel isn't getting stuck as you're trying to put your shoe on. That could lead to frustration. And it's also helpful for taking it off as well. It also kind of serves a purpose to hold the shoe in place so it's not sliding around as you're trying to put it on. So next, I would like to talk about the sock aid, that top one right there. This, you might need to help your loved one put the sock around that bottom part. So as you can see, there is a white plastic piece, and you want to put the sock on over that end, and then your loved one will put their foot in, and then they will hold the ropes and pull it up over their foot and over their ankle. And these come in hard plastic or they come in a softer material. So depending on what your loved one would like more, there's a lot of different options for those. And there's also a lot of good videos on YouTube on how to use a sock aid. And next, elastic shoelaces, or really any other type of shoelace that doesn't need to be tied, are options if tying the shoes is difficult or time consuming. Doing something like having little like magnetic shoelaces instead of having to tie it together, as you can see here, that has like a little clasp on the top. And then they also have more tighter ones with that kind of look like little springs that you can put through that don't require a shoe to be tied. There's also slip-on shoes, or you can also opt for Velcro shoes. So next, I'd like to move on to oral care. So as you can see, there's a few different options here for doing things such as holding a hairbrush, holding a toothbrush, holding a razor, different things like that. So here on the left is a built-up grip. They are round foam pieces and they come in different thicknesses depending on how big you need them. And so these can be inserted just into an object. And as you can see, they have different colors and they're pretty soft. And so if your loved one, just has some difficulty holding on to like an end of a toothbrush, they might not need a much bigger or thicker grip. They can maybe opt for a thinner one. But as their fine motor skills decrease or they have more difficulty with it, you can always use a larger grip to help them hold on so they're not having to grab an object as tightly. And if they're having trouble still holding onto an object, another good option is that universal cuff. Essentially what it is it has that kind of rounded part that goes over the hand to secure it, as opposed to the hand itself securing it. It has that tight grip on the back of the hand. So they are holding the object still in their hand, but it can be a looser grip and it won't fall out of their hand, so they won't drop it as much. So those are two different options. They come in a lot of different sizes, colors, different things like that. But those are good things to use even for eating and things like that. They can be placed on many different objects, even a pen. So other helpful tips for oral care, opening and closing toothpaste caps can be difficult. So if you want to opt for the flip up caps, so you're not having to twist the toothpaste as much, that's a good option. They also have self-sealing toothpaste caps that can be found online. Or pump toothpaste is an additional option if the squeezing part of the toothpaste is the difficult part. You can just use the pump, and so it's kind of like a soap pump, just with toothpaste. And again, like I said, you can add those built-up grips or that universal cuff to the toothbrushes. Getting an electronic toothbrush will minimize the brushing motion, so they're not having to go back and forth. This can kind of help them be more thorough while they're brushing their teeth by using an electric toothbrush, because it kind of does that back and forth motion for the person. You can also get weighted grips to minimize tremors while brushing if tremors are an issue in completing oral care. They have different weighted grips online, and similar to those built-up grips, they just will be inserted into the toothbrush, and it will kind of help cancel out that tremor a little bit. And then flossing picks or floss holders are good alternatives to single strands of floss. Just less, movement with the floss, less having to navigate, wrapping it around your fingers and moving around your mouth. You can do floss picks or a floss holder. Different things like that are options and alternatives to flossing. So as far as bathing, a handheld shower would be a good option if, larger movements are difficult for them. This allows them to stay standing in a smaller area of space and they kind of have the shower move around them as opposed to them trying to move around, the areas that they need to be washed. Or a long-handled sponge is a good option for getting the back washed. This, they're able to just hold the end and then wash as much as they can and require less assistance for thoroughness on their back. Some more tips here. A lot of the times caps can be difficult to open, especially if they're having trouble with fine motor skills. So picking like a 3-in-1 soap will limit the number of bottles or caps that are needed to be open. A long-handled sponge can be used to assist with washing the back and the lower body, kind of like I mentioned before. And then that handheld shower head allows just for a wider range of movement without having to stand up and move around in the shower. And then also ensuring that the floor outside of the tub or shower is completely dry before getting out will also help with some balance stuff because if the floor is wet, it creates a fall risk. So ensuring that outside of the shower is nice and dry. So some more adaptive equipment for the shower. There's a picture on the left of that white chair that's called a shower chair. And this is just placed in the shower. And this allows them to sit to complete their showering process in a safe way. They also have transfer benches if you have a tub and it's difficult for your loved one to get over and into the shower because of that tub part. A tub transfer bench is a good option because this allows them to sit down outside of the shower and scoot themselves over into the shower. And so that also provides additional support when getting in and out of the tub too, if again, stepping over is difficult. And then that top right picture is a grab bar, and this helps give extra stability while standing in the shower. Just make sure that these are installed correctly and they're very sturdy prior to being used. As far as toileting, there's a few different options for that. There's a toilet riser, which is that top picture on that right side of the screen. And this can be placed over the toilet and can easily be taken off as well. And as you see, there's also some grab bars around there that are on both sides if your loved one needs a little bit of extra support while sitting down or standing up from the toilet. And it also kind of helps them, see where they're needing to sit. And then that bottom picture is something called a toilet tong. It holds toilet paper on that bottom portion, and it can help with wiping if, reaching around with your arm is difficult. And these are also good for people who have limited movement in the shoulders. It kind of eliminates that reaching extra to wipe. And you can also consider having your toilet paper put into pre-made lengths. This is something the caregiver can do. Ideally, maybe about an elbow's length if tearing toilet paper off the roll is difficult, if they're having a difficult time physically tearing it, or whether it's a issue with seeing how much they have and kind of judging the amount of toilet paper that they need. Getting it into pre-made length is also a good option. So we do not endorse any retailers for any of the adaptive equipment. However, some options for different retailers to purchase these items are Amazon, Walmart, Walgreens, and you can also check out the Alzheimer's store. So to find these products, simply just go to the name of whatever retailer you are wanting to get something from, or you can put it into Google and you'll just type the name of the product in, and then it'll come up with products that are a variety of price points, whatever to fit your need. So thank you guys so much for watching. Before I close out of this presentation, I just kind of wanted to reiterate that some of these things might work for just a small window of time, and that's okay. You might still be helping them use some of this adaptive equipment, and that's also okay. The purpose of incorporating this equipment into the daily routines is to allow your loved one to still maintain a sense of independence and kind of maintain that dignity through all of these processes in some of their daily routines, and getting them involved as well. It can be something fun to do together and something fun to learn together. But again, if you have any questions, feel free to reach out to the KU Alzheimer's Disease Research Center. And thank you guys so much for watching.